Standard precautions, your shield against Lassa fever. Lassa fever remains a serious public health threat in Nigeria and across West Africa. But here's the truth, healthcare workers don't have to become victims. Standard precautions are not optional, they are your shield. Today, we'll walk through what Lassa fever is, how it spreads, and how strict infection prevention and control (IPC) protects you, your patients, and the community. What is Lassa fever? According to the Nigeria Center for Disease Control and Prevention, Lassa fever is a viral hemorrhagic disease caused by the Lassa virus, a single-stranded RNA virus from the Arinaviridae family. It is a zoonotic disease. Its primary reservoir, the multimammate rat, Mastomys. Each year, West Africa records between 100,000 and 300,000 cases. An estimated 5,000 deaths occur annually. Nigeria has over 58 million people at risk, and healthcare facilities can amplify outbreaks, especially when ICPC gaps exist. What is the current situation? Recent surveillance shows a concerning rise in healthcare worker infection. As of the epidemiological week 7, 15 confirmed cases and 2 deaths among healthcare workers were reported across multiple states. At AKTH, 6 suspected cases have been identified, 1 confirmed. This is not just a community problem, it is a healthcare system challenge. How Lassa fever spreads. Lassa fever spreads through contact with infected body fluids, blood, urine, vomit, feces, saliva, semen, breast milk, sputum, amniotic fluid, cerebrospinal fluid. Transmission occurs when these fluids contact eyes, nose, mouth, broken skin, needle stick injuries. In healthcare settings, infection often occurs due to poor hand hygiene, inadequate PPE use, contact with contaminated surfaces, improper sharps handling, delayed recognition of suspected cases. Lassa fever does not knock before entering. It exploits gaps. Why IPC matters. Outbreaks are increasing in frequency and scale. Healthcare facilities can either stop transmission or amplify it. Evidence-based IPC measures reduce healthcare-associated infections, protect staff, strengthen outbreak containment, preserve community trust. IPC is not paperwork, it is protection. What are standard precautions? Standard precautions are basic infection prevention measures applied to all patients at all times regardless of diagnosis. They include hand hygiene before and after every patient contact, risk-based use of PPE, safe injection practices, respiratory hygiene, safe sharps disposal, proper waste management, environmental cleaning and disinfection, safe linen handling, appropriate patient placement. These are the minimum required protections. Minimum does not mean optional. Essential supplies. Facilities must ensure availability of PPE, hand hygiene supplies, disinfectants, sharps containers, medical waste bins, functional isolation areas. Without supplies, compliance becomes impossible. Preparedness begins with provision. Screen, isolate, notify. When a suspected viral hemorrhagic fever case presents, screen using standardized tools. Isolate immediately in a designated holding area. Notify the LGA DSNO or state epidemiologist. Early action saves lives. Delayed recognition spreads infection. High-risk areas in facilities. Healthcare worker infections commonly occur in emergency rooms and triage areas, ICU and isolation wards, laboratories, mortuaries. But remember, outpatient and general wards are not low risk. Undiagnosed cases often appear there first. Support staff, cleaners, porters, administrative officers are also at risk. IPC training must include everyone. Before you touch a patient, ask yourself, what contact will I have? What procedure am I performing? What is the likely transmission route? What PPE is required? What is the risk of splashes or needle stick injury? Perform a point of care risk assessment every time. Pause, assess, protect. Why healthcare workers get infected? Key drivers include low index of suspicion, inconsistent PPE use, IPC gaps, delayed care seeking, community exposure. On average, some healthcare workers delay up to 6 days before seeking care. Fear of stigma must never override safety. Early reporting protects colleagues and family. Impact on the health system. When healthcare workers fall ill, services are disrupted. Workload increases on remaining staff, infrastructure becomes strained, community trust declines, economic consequences follow. Protecting healthcare workers protects the health system. Strengthening occupational safety. We must reinforce standard precautions, improve hand hygiene compliance, ensure proper surface disinfection, use PPE appropriately, strengthen risk communication, conduct regular training and retraining, implement post-exposure protocols, enforce waste segregation at source. Preparedness is not an event, it is a continuous process. Preparedness and readiness. Preparedness means having systems in place before emergencies occur. Readiness means being able to respond rapidly and aggressively to contain outbreaks. This includes emergency response plans, surveillance systems, laboratory detection, risk communication, case management, IPC programs, logistics support. IPC is a basic requirement for outbreak preparedness. IPC is everybody's business. Infection prevention and control requires a multi-sectoral approach. Healthcare workers, managers, policymakers, patients, support staff. One nation, one plan. Preparedness starts before the epidemic. Conclusion. Good IPC knowledge and practice are essential to preventing the hospital spread of Lassa fever. High-risk procedures require enhanced PPE, including N95 respirators and coveralls. Lassa fever can be successfully managed in secondary and tertiary facilities when IPC is institutionalized. Standard precautions are not just guidelines, they are your shield. Infection prevention and control is everybody's business. Thank you.